If you've never been out here, make sure once COVID is over that you come out here. You are looking toward the Pine Ridge Reservation in South Dakota. All of South Dakota, all of western South Dakota and much of the neighboring states was once the Great Sioux Nation. I'm going to tell you a bit about that later. But this is now a reservation. It's the largest. It's home to the largest tribe in South Dakota. We'll be talking more about them. But even though we're on a native reservation, the problems they face here, particularly as it relates to work and business, are the problems all Americans face. So for the next several weeks, I will be going across America talking to people about the struggles that they are facing until we get a vaccine and until we end coronavirus. And as Thanksgiving weekend draws to a close, here's a story that serves as a reminder that disregard for indigenous people is not America's shameful history. It is our shameful present. This is a story happening right now, right here, just about 3 hours from where I am in South Dakota, where Native Americans are trying to protect themselves from the deadly pandemic that is raging across their lands. And not only are they not being supported by federal and state authorities around them, their safety measures that they're trying to take and enforce are being actively thwarted by those officials. Quote, "It was not so long ago that my people witnessed catastrophic disease and death that decimated our population, destabilized our society, and almost wiped us out."
This is talking about the Indian people of the great nation of Native American people in regards to the coronavirus that is now excelling in rates up in that area that have absolutely been devastating, mind-boggling, even to other previous stats that we have taken either from California, Texas, or New York, has been just absolutely mind-boggling, to say the least. Once more, it looks as if that great darkness has fell upon to our land once more again here in the Americans.
If it were not for sovereign powers of self-government, we would be at the mercy of Donald Trump and Kristi Noem, which would be a disaster of potentially existential proportions for our people. End quote. Those are the words of an attorney and a member of the Cheyenne River Sioux tribe, which is currently suing the Trump administration for coercion and threats made against them by the federal government at the urging of this woman, South Dakota Governor Kristi Noem. The tribe's lawsuit alleges that
she was one of the ones that refused to make a plea of mass mandating in her state, even after she understood the devastations that was happening.
In May, Governor Noem appealed to the White House to force the Cheyenne River and Oglala Sioux tribes to remove checkpoints on state and federal roadways that cut through their reservations. Checkpoints like the one you see here on your screen. This one is from Pine Ridge. They're part of the tribe's robust COVID-19 prevention programs, which include mask wearing, mandates, mass testing events, contact tracing. It's a stark contrast to the laissez-faire approach of Governor Noem, who's...
Now listen, this is a people that has already been subjected to great genocide. This is a people that still wants to live and remain living. And their governor is ordering for them to do just the very opposite.
State has one of the highest positivity rates in the nation right now. Joining me now is Remy Baldeagle. He's a spokesman and intergovernmental affairs coordinator for the Cheyenne River Sioux tribe. Remy, good to see you. Thank you for being with us. I just want to emphasize a point that you have made in this battle. I stopped at one of those checkpoints last night as I came onto the reservation, and they took my car license, and they asked me how I was feeling, and they asked me if I had symptoms, and they asked me what I was doing and where I was going and where I was staying. To Native Americans, disease is existential. Most Native Americans on this continent, and Canadians and Mexicans, were wiped out by disease. This is something that is in your DNA as something that can wipe out your people.
Absolutely. Hiani Washtem and Takiapi. Good morning, Mr. Velshi. It's an honor to be on your show this morning. And welcome to the treaty territory of the Great Sioux Nation. We're still a nation. We are still all here. And it's one of the things that often get forgotten in the political battles that surround this pandemic. And you're absolutely right. Native communities across the United States, particularly in large land-based tribes like ourselves, are extremely vulnerable to pandemics. A lot of people don't realize that we've fought these pandemics not only in 1918, but as recently as a few years ago, and we had a tuberculosis outbreak on the reservation. If it wasn't for those experiences, we wouldn't understand the necessity of the actions that we have to take today, especially when you look at the fact that those actions necessary to try to control this pandemic haven't been taken around us.
Right, and your point is not to tell Governor Kristi Noem or the rest of South Dakota how they're supposed to behave. You're just asking for the ability to have some control over who comes onto sovereign native land. And again, all you're doing is you're asking them what's wrong, where they're going, asking them not to stay if they don't have business on the tribal land. This isn't complicated. You're just asking for an element of self-control that you believe you're entitled to by law.
Yes, it's unfortunate, especially given our geographic location and the state that surrounds our lands, that everybody has a freedom to do what they wish until it comes time for Indians to do that. You know, we have thousands of people that live on the reservation, and we don't have the resources that a state government or a federal government has to help control and keep our people safe. So we have to work with the resources that we have. And what we have is strong, resilient people who are willing to step up and help put in some mechanical engineering controls to help control the flow of this virus, because the virus doesn't travel by itself. People carry the virus. And that's, you know, when you look at the fact that we have thousands of people that live here and we only have 8 hospital beds in our service unit, and the nearest critical care unit is 3 hours drive time off the reservation. And so we have to work hard with what we have.
Remy, I'm learning some Sioux words while I'm here on the reservation. Tiatani Yankapo is a word that you is a phrase you tweeted the other day about people staying at home. Tell me about it.
Good girl.
Yeah, it's important to realize that on our reservation we ask a lot of the individuals on our reservation, and right now we're currently all following all the CDC protocols we can. We're asking our people to stay at home, to keep each other safe, especially our vulnerable populations. It's important when you realize that Indian country is severely lacking in housing. You know, we have an estimated housing shortage of 1,300 homes on just our reservation. And a lot of our homes have multiple families that live in them. So if the virus gets into one home, we're going to have a small spreader event in each individual home. And it's one of the things that we're really afraid of and why we're so vulnerable.
And of course, you're worried about the fact that, as is the case across the country, this affects the elderly. But in the case of Indian reservations, these elderly are literally your elders. They are the people with the language and the people with the stories and the people with the tradition. 9% of the state's population are Native Americans, 15% of the deaths. Remy Baldeagle is continuing in his efforts with the Cheyenne River tribe to try and control the spread of coronavirus on Indian lands in South Dakota. Remy Baldeagle, thank you for joining me, sir.
Thank you for having me on, Velshi. I just want to shout out to all the tribes that are working hard today to keep their people safe. Sisseton, Oglala, Rosebud, Lower Brule, Cheyenne River, Crow Creek, Standing Rock, all of our love to everybody in the state and to our relatives. Thank you.
Thank you, sir. South Dakota is one of the hardest hit states by the raging COVID pandemic, with healthcare workers scrambling as resources dry up. We're going to speak with one such nurse caught in the heart of the outbreak. Those harrowing details coming up next. Plus, our small business expert panel is back in the next hour to give their best advice to business owners and workers on weathering the coronavirus surge. Send me your questions at mystory@velshi.com. We're going to answer more.
I hope now that you understand the Native American people I don't want to use the word suspicious, because God's chosen people that's been selected by God are not afraid of God, and we're not afraid of the supernatural in any form. But we have lost so much, it makes us more resilient in looking at the signs, regardless whether it's the signs coming from the seas, the signs coming from the droughts, the signs coming from insects, the signs coming from diseases, signs coming from a government that is out of control in its spending habits and not taking care of its general population, pertaining to various governments that have turned into a communist type atmosphere setting, and how that they have withheld information, or how that they have attacked various citizens in their countries. The Native American people are more sensitive to these things because we have come so close in becoming genocide. And I realize that, Hanukkah is like 2 weeks away. I think it begins the 12th, if I'm not mistaken, the 12th of December. It may be the 15th of December. I have to look at the calendar to be sure. But it's approximately 2 weeks away for the day of Hanukkah, that so many people recognize the distinction and recognize what went on with the Jewish people towards them being almost completely genocide of over 6 million people. I realized that we set aside these times to honor the dead, to honor the event that happened to the people that at one time was living and now they're dead. There has never been any type of major movement in that regard towards the Indian people. And if the truth be known, it wasn't just 6 million people that died over here in the Americans, but it was probably more like 3 times that many. Because these events went on simultaneously for years and years, regardless whether it was happening out east or down south or out west or up north. So whenever you look at how sensitive that the Native American people are, they have a reason for being sensitive, because they come so close of being genocide. And it's really sad whenever they have their own governor in their own state that's fighting against them of their lives and their safety pertaining to these issues.
For them on air.
Time to start it.
Like they was talking about, if we was depending upon Donald Trump and the government of America right now in this administration, we would be doomed.
We'll make a lot of.
Good morning. It is Sunday, November the 29th. I'm Ali Velshi, and as of this morning, there have been 13,311,280 confirmed COVID-19 cases reported nationwide since the beginning of the pandemic. The death toll has climbed to 266,826. Millions traveled for the Thanksgiving holiday despite CDC warnings not to. Those travel plans continue this morning. The TSA reports that more than 1 million travelers passed through our airports nationwide on November 25th, the day before Thanksgiving. Many are returning home today. A Business Insider survey found, quote, 37% of people did not plan to change how they celebrated Thanksgiving this year. They traveled on planes, trains, and buses around the country. The experts have warned that airports and other travel would be a source of further infection. The U.S.'s top infectious disease expert, Dr. Anthony Fauci, warned that, quote, that's what's going to get us into even more trouble. The Washington Post reporting, quote, as daily COVID-19 deaths climb to levels not seen since early in the pandemic, 9 states have hit one more grim marker. More than 1 in every 1,000 people dead of coronavirus-related causes. On Friday, South Dakota became the latest state to reach that unwanted marker, joining others that include New York, New Jersey, and neighboring North Dakota, which currently has the highest COVID mortality rate in the world. Ihanilasi, it's Lakota for it's early morning, has the highest COVID mortality. New Jersey and neighboring North Dakota, which currently has the highest COVID mortality rate in the world, that include New York, New Jersey, and neighboring North Dakota, which currently has the highest COVID mortality rate in the world. Ihanilasi, it's Lakota for it's early morning here, just outside of the Pine Ridge Reservation behind me in the Badlands region of South Dakota. We've once again taken to the road as part of Velshi Across America, traveling to key locations across the country, areas that have been hard hit by the coronavirus. Even before the arrival of COVID-19, Native American communities had the country's lowest life expectancy. Now South Dakota is reporting some of the highest COVID deaths per capita in the United States, and families on the Pine Ridge Reservation are fighting not only for their jobs and their way of life, but for their very lives. With a positivity rate of 24%,
Wow.
South Dakota and neighboring North Dakota have the highest incidence of COVID-19 cases nationwide over the past week. It's a stark illustration of the problem facing many rural communities from coast to coast in America. Quote, the Dakotas have the most people in hospitals per capita, according to data from the COVID Tracking Project. That's a shift from the spring when hospitals in mainly urban states like New York and New Jersey were overflowing with patients. It's from the Wall Street Journal. South Dakota emergency room nurse Jody Daring made national headlines recently and spoke with CNN about a series of tweets that she posted, noting that she has treated COVID-19 patients who still don't believe the virus is real, even as they are hospitalized with it.
I think the hardest thing to watch is that people are still looking for something else, and they want a magic answer, and they don't want to believe that COVID is real. And they should be spending time FaceTiming their families. They're filled with anger and hatred, and it just made me really sad the other night. And I just can't believe that those are going to be their last thoughts and words.
Now, as a motorcycle rider myself, I have always dreamed of coming to the annual motorcycle rally in Sturgis, South Dakota, not far from here. But some public health experts point to this year's rally, which was held in August, when more than 400,000 people packed the streets, as a key contributor to the growing outbreak in the region. The New York Times reporting, quote, South Dakota's Republican governor, Kristi Noem, a vocal opponent of lockdowns, gave her blessing. Local leaders set aside their misgivings, and thousands of people from every state in the nation rolled down Sturgis's main street. One study estimated that the 10-day event, deemed a super spreader by some experts, may have been responsible for more than 250,000 new coronavirus cases. Meanwhile, in North Dakota, as of this morning, COVID-19 has infected more than 77,935 people and claimed over 915 lives. In late October, the mayor of Fargo, the state's largest city, started requiring all people to wear face coverings while indoors with people who are not from their households. While there's no actual penalty for violating the mandate, officials there believe that it has helped curb further spread. Joining me now is the man who put those measures into place, Tim Mahoney, the mayor of Fargo, North Dakota. Mayor Mahoney is also a general and vascular surgeon, which helped inform your views because, frankly, Mayor, good to see you. Frankly, the Dakotas have not been at the cutting edge of doing the right thing around the spread of coronavirus.
Yes, it took a while for people to catch on that the masking would help quite a bit, and also social distancing, hand washing. We're really pleased now. The last 2 weeks, our numbers are starting to drop. And I think you quoted this last week, we were high, but we're
So you have to ask yourself the simple $64,000 question. How come it's just now starting to sink in with various tribes and people that wearing the mask, trying to take preventions, does help in lowering the cases? I'm going to tell you why. It's because of this administration that did not take the coronavirus serious whenever it first broke out in January, whenever various people knew that it was on its way. Yes, the president done certain things, but the president also failed to do certain things. And by him failing to do certain things, in which he uses the excuse that he didn't want to start a panic, by him failing to do certain things, has now jeopardized all of us in putting us where we are now towards a super spreader event. In other words, if the people that was in that motorcycle shindig, I'm going to use the word shindig, would have known that this was really this serious, I truly believe that some of them, not all of them, but some of them would have deterred their reasoning in going up and being involved in a super spreader event. What they say, it was 30,000 people in that one little town, in that one little area. It's sad that we have had poor leadership throughout one of the most biggest health crisis events in a century. It is sad that we have had this type of leadership response here in America that has led people astray in thinking something that was just totally inaccurate pertaining to this lethalness of this disease. It is so sad. I rather overdo something than to underdo something. I rather be overly prepared than under prepared. In other words, let's go ahead while we're building a house because we're in Tornado Alley. Let's go ahead and spend another $4,000 or $5,000 on some sort of a safe house or a tornado shelter. I'd rather go ahead and spend that money up front in knowing that this was what could very well possibly save my life if necessary for me and my family to have to get off into, than I would to regret after the fact in saying to myself, you know, $5,000 could have saved not only my life but my whole family's life if I'd have just invested that $5,000 on the front end before I ever really got engaged towards building this house. It works the same way. It's an insurance clause, basically, that you use whenever you put out an overreach in regard of any type of danger, regardless whether it's a natural catastrophe danger as far as a tornado or a natural catastrophe danger pertaining to a pandemic. And I still weigh heavily on thinking that the pandemic was not a naturally catastrophe event. I still weigh that it was done intentionally to the people over in China, that is now spread all over the world, that is going to affect this planet in a substantiating way. We're just now seeing the beginning developments of all this. I mean, they talk about this vaccine that they're coming out with. Well, first of all, whenever you have over 7 billion people on the planet, do you have any idea how long it's going to take to vaccinate everybody? It'd probably take 5 years if you started making it by the trillions, by the thousands right now, to be able to vaccinate that many people. And as far as the economical damage, this has already put this planet in economical peril. There's places in France, Germany, England, over in other parts of the world that are wreaking devastation because of this coronavirus that has creeped up into their economy, and now it is causing so much problems.
We're starting to come down, and our incidence is coming down as well. We're seeing good compliance in the community and throughout the state. A lot of the other mayors followed our lead, and 70% of the state did that, and the governor last Friday declared a mask mandate as well. So we're seeing a good compliance,
Right,
and we're also seeing our numbers drop.
And we don't have a mask mandate where I am in South Dakota, but like South Dakota, much of North Dakota is rural. And as a result, cities like yours are not just important because of the residents of Fargo, but because of the fact that people who are in more rural areas of the state, once their hospitals are overwhelmed, they've got to come to places like yours, which then overwhelm your hospitals.
Yeah. Absolutely. We have the largest healthcare system in the state with two big systems that are here. We have adapted to be ready for transfers from throughout the state. Our healthcare systems have done a good job of that. And so far, we have not hit a capacity surge so far, and we are able to handle all the cases that we need throughout the state.
What is the situation that we've been hearing about in some states where you have shortages of nurses, of healthcare providers, generally frontline workers, but of nurses and doctors? What state are you in with that in North Dakota?
Well, what we have is approximately 10% of the people are infected that are in the healthcare field. So that has caused some trying to get travelers, have other people come in our community. It's a challenge in rural states because we don't have a lot of other people to place in those situations. What it does do is change the shifting in the hospitals as far as certain cases and certain things that they do so that they can have enough people to take care of the COVID patients. At this point, we're at surge level 1, and we have many more surges that we can go through, and we have the capacity to handle what we have coming our way.
Well, Mayor, we will keep a close eye on Fargo, North Dakota, and your state, and we wish you well in your fight against this new surge of coronavirus. Tim Mahoney is the mayor of Fargo, North Dakota. Thank you for joining me, sir.
Thank you very much, sir.
I'm going to let this number sink in for you watching at home. 1 in 1,000. That's the number of South Dakotans who have died from the coronavirus. Let me say that again. 1 in every 1,000 people living in South Dakota have died from this illness. The number is even worse among certain groups, including those who live right behind me. Native Americans have been hit the hardest by the virus over every other ethnic group. They make up 9% of South Dakota's entire population, but they represent 14% of all cases and 15% of all deaths. Cases of this coronavirus in South Dakota are the second worst in the nation. North Dakota is the worst. In both states, hospitals, as we've been discussing, are getting close to capacity. When North Dakota's hospitals reached 100% capacity, its governor, as we just heard, allowed nurses who had tested positive but were asymptomatic to continue working at COVID units. It's gotten so bad there that 60 Air Force nurses were sent to assist frontline workers. These healthcare heroes are fighting the courageous frontline battle against the disease. I'm joined now by Kathy Gubin. She is a nurse at Avera St. Luke Hospital in Aberdeen, South Dakota, which I think is about 200 miles to the northeast of where I am. Kathy, thank you for being with us. Give us some sense of what the situation is in Aberdeen, who your patients are, and where they're coming from.
So certainly we are in our surge right now, something that we have been preparing for months. And our patients are coming from all over the state of South Dakota. And we have had patients from other states as well.
you do work in palliative care, so you are familiar with some of the things that some of your colleagues have not had to become familiar with. The idea that you're dealing with patients who are at the end of their life and who, in this case, may be passing without the benefit of their family around them. In some cases, we've been hearing people who still are not really at peace with the idea that they even have coronavirus. How has it been treating patients?
Well, you're exactly right. And it's been hard. It's been very difficult, as I'm sure many healthcare workers across the state and the nation would agree. People are surprised that they can be this sick from COVID and are surprised that they're going to end up being in the hospital for weeks. And family members who can't see their loved ones on the other end are scared and fearful and yet hopeful that their loved one is going to make it through. And it's very challenging to have to share when someone becomes very ill and we don't feel they will make it.
And normally in palliative care, it's because somebody has some illness that their family will have become accustomed to. They will know they've got that. You're dealing now both with patients and families to whom you're not just dealing with the normal stuff where you're trying to get them comfortable with how things are going to go, but you're convincing to some degree or having to, having to sort of make people understand, both families and patients, how serious this is, that their family member could die.
That's exactly right. There's a fair number of patients that come in and think this is going to be like a typical pneumonia. They're going to be in for 2 or 3 or 4 days, and I'll be out of here in just a few days, and I'll go back to my life as normal. And part of my role has been helping prepare families and patients that this might be a marathon. This might be a 3 to 5 week stay, and we can't always predict what that stay is going to be like. It may become very serious, and we have to talk about the tough stuff. We have to talk about, do you want to be put on a ventilator if your breathing gets worse? And what do you want us to do if your heart stops? And there are some people that are just shocked that we're having to have those conversations.
Right to will.
We talk about anxiety, and we've talked to a lot of nurses in the last several months about what it's like to be them. We all accept that you are empathetic people. We all accept that you are used to seeing hard things and dealing with people. This feels harder for a lot of nurses.
This feels a lot harder. I think that we've seen things in the last weeks and months that many of us who've been nurses for a long time or been in healthcare for a long time have never seen. You're right in that we can't predict how one person's COVID hospitalization is going to go. It's not like a heart failure or a cancer patient, like you said. It can be very unpredictable. These patients can end up with multi-organ failure. And it doesn't matter if you're young and healthy and fit and been exercising.
What a thing. Kathy, thank you to you and to all the nurses, not just at Avera St. Luke Hospital in Aberdeen, but frankly across South Dakota and North Dakota and across this country who do what you do every day to keep us safe and to keep our...
In other words, whenever it attacks your immune system, it just don't attack just one particular part. It attacks everything. Not just your lungs, but your kidneys, your liver, your spleen, whatever that you have. It can absolutely just shut the whole body system down to the point that regardless whether you're an athlete or you're 90-year-old or you're 9 days old, it can be devastating in one's life. That is the mystery in behind the coronavirus towards how some people can get it and brush it right off and just be a carrier of it, while others get it and it's devastating.
Our families comforted. Kathy Gubin is a nurse at Avera St. Luke Hospital in Aberdeen, South Dakota, about 200 miles northeast of where I am now. Coming up next, I may be in South Dakota right now, but coming up next, I'm going to acknowledge whose land this truly is and what needs to be done to fight for the rights of the Native American community. Take another look at this beautiful land that I'm in right now.
We're at the movies and we need
acknowledge that the ground on which I am standing are the ancestral lands of the Oceti Sakowin. That means the Seven Council Fires. That's the proper name for the people referred to as the Sioux. Most of western South Dakota and portions of neighboring North Dakota, Montana, Nebraska, and Wyoming were part of what was once known as the Great Sioux Nation. Here in South Dakota, there are 9 federally recognized Native nations: Cheyenne River, Crow Creek, Flandreau Santee, Lower Brule, Oglala, Rosebud, Sisseton Wahpeton, Standing Rock, and Yankton Sioux. Now, what I just did there was a land acknowledgement. Where I come from in Canada, we've started doing that at the beginning of most gatherings. Land is central to the identity and culture of Native Americans, and offering a land acknowledgement has come to be seen as an initial step in the reconciliation of America and its indigenous presence. While these land acknowledgements don't change the fact that America has broken virtually every treaty it has ever made with indigenous people, the statement of fact that we are on their native land brings awareness to a history that most Americans never learn in school. The history of America's indigenous people dates back thousands of years. The issues over land ownership began with colonization. When colonizers weren't outright killing Native Americans, they were making grossly unfair treaties with them, drastically reducing their access to the land they hunted and fished. Ultimately, American Indians sued. In 1980, the Supreme Court upheld a claim by the Lakota Sioux that the United States broke its treaty obligations with respect to land on which Mount Rushmore sits, the Black Hills, and that land rightfully belongs to the Sioux. Now, at the time, $105 million was put in a trust as a settlement. It's thought to have grown to about $1 billion today. The Lakota, most of whom now live on reservations like Pine Ridge behind me, maintain that they don't want the money. They want their land back. Now, land was both sustenance and identity for Native Americans, but that came into conflict with the needs of colonizers to occupy this country from sea to shining sea, to access gold and silver, to build rail lines and telegraph lines and mail routes. Our wealth would have been their wealth, or maybe they'd have done something else with the land and water. What we know is that Native Americans have very little representation and few allies in state and federal governments. They are among the worst off in America, with poor access to health care and some of the lowest life expectancies, highest unemployment, and highest school dropout rates in the country. Pine Ridge doesn't even have consistent, reliable cell and internet service. So imagine trying to run a business or remote learn during these stay-at-home pandemic times. So whether 2020 represents to you political change, social justice, or a change to your way of life that we have not faced in our lifetime, understand that there remain people among us, people who have been here longer than most of us, who benefit less than we do from this country's riches. Land acknowledgements won't change anything for Native Americans, but finding out who occupied and lived off of the land on which you now live is a start.
I have done a great deal of research in what he's talking about right now. And the Sequoia Museum up in eastern Tennessee, where Sequoia taught the Cherokee people how to understand English language pertaining to the alphabet, is a exotic place, to say the least, up in the hills of the Appalachian Mountains, and going over into places like Maggie's Valley and Robinson, North Carolina, and Cherokee Village. And you can find places up there in Snowbird and other places in the Appalachians to where you come into neighborhoods to where people to this day still cannot speak good English because of their tribal descent. So what he's talking about in giving people a bit of a history lesson here is absolutely 100% correct. And it's not just in the West, it's not just in the Northwest, it's not just in New Mexico, but it's all over this country. While I was out in New Mexico, northern New Mexico especially, in the Taos area, up towards Eagle's Nest and Angel's Fire, they call it the Enchanted Circle. I had an opportunity of meeting with some of the most loving, caring people of different cultures, different Native American groups that I had ever experienced before in my entire life. It's New Mexico is abundant with life, not just American life, not just Indian life, but Spanish life too as well. Like I said, you can be up there and literally go into a neighborhood and it's almost like going into another country. It's that different. It's that unusual.
And once we start, who knows what justice and equity may follow for our Native brothers and sisters.
The need has always been there. This year, it just happens to be greater.
God bless Red Cross and Salvation Army for their works that they have done. They've helped many, many people.
Feel.
All right, I got a mask on, which means I've got a guest with me. We are back from the edge of the Pine Ridge Reservation in South Dakota. It is beautiful, and it's back there. The ongoing COVID crisis in this region has highlighted the sharp contrast between the hands-off approach of the state government, how they've been dealing with the virus, and how aggressively Native American communities have fought the spread of the virus. The governor of the state, Kristi Noem, a Republican who has avoided statewide mask mandates, has criticized these checkpoints that have been set up by local tribes in the state in an effort to protect those living on tribal land from the rampant spread that they've already seen. In an ongoing battle back in May, Noem asked the Trump administration to help intervene in a compromise to allow checkpoints on tribal roads, but not on state and federal roads within the reservation. Now, in June, the Cheyenne River Sioux tribe sued the federal government, alleging that ever since Noem's plea for the White House's help, the Trump administration has abused its power by coercing the tribe to end its COVID-19 response plan, including the checkpoints. Now, that lawsuit continues. The tribe plans to continue in the coming days to the federal government's request, but to dismiss the case. But in the meantime, the tribe's 9 checkpoints remain up. I want to continue this conversation with State Senator Red Dawn Foster of South Dakota, who represents District 27, which is actually not the Cheyenne River Sioux. She is part of the Oglala Sioux and Navajo tribes, but she's part of this reservation here. Same thing happens here. You've got checkpoints here as well. I passed by one yesterday. What's the point of the checkpoints and what's the controversy?
Oh, thank you. Thank you for having me on here. The point of the checkpoints were to limit on just traffic coming into the reservation that normally wasn't living here. This is a matter of life and death on a reservation, and so we needed to limit the spread and people coming off the reservation and coming into our communities and potentially wiping our whole community out.
And just, I want to make that point because that sounds extreme unless you're a Native American. The idea of disease coming into your communities and wiping them out is very, very real in your institutional memory.
Yeah, absolutely. We have that historical memory of that happening, wiping out. I mean, it diminished our whole tribes. And then also in the current contemporary, so we, as you said, I'm Navajo. So we saw what happened in Navajo Nation coming in and running rampant. I believe they're in a lockdown right now. Yeah. So it was a very strong attempt to limit that spread and to make sure that we were doing everything we can of, upholding our sovereignty and protecting our citizens here.
You came here from the reservation, so maybe when you go back, you'll hit the checkpoint.
Yes.
They're not particularly onerous.
No.
There are a couple of guys who ask you, they take your car information down, they ask you who you are, how you're feeling, where you're going. The issue is that there are state and federal roads that run through these sovereign nation lands, and the governor is saying that's interstate commerce. You can't interfere with people who are traversing through the nation, and your people are saying, come on, it's ours.
Yes.
We need to not be sick.
Yes, it's part of our sovereignty. Our sovereignty supersedes the state, even its existence. So it's just us upholding our sovereignty. And this case has already been settled. with Rosebud versus the state. So it is a moot point. We have the right to have these checkpoints. It's in our best interest. It's about maintaining our health and wellness and protecting our people.
Now, the issue is Native Americans make up about 9% of the state's population, 14% of the infections, 15% of the deaths. Why so high?
Why so high? Well, I think that you see the underlying health issues that are here. There's overcrowding. There's multi-generations living in one single home, and then there's a high rate of diabetes. So I think it's 20% of the households lack running water. So that predisposes us to having a harder time with COVID. So 14% of the population. We just buried 3 elders that were fluent language speakers last week. So that's huge.
That's your culture, that's your oral history,
yes,
that's your institutional memory. You also have a situation here where you said houses that don't have running water, hard to get cell signal. High-speed internet, broadband. So if we're fixing things because of coronavirus, which we're going to have to, I think we've learned that there's a lot of stuff broken. There's a lot of people working for too little money, a lot of kids who don't have broadband at home to be able to learn at home. You'd like this fixed better than it was before coronavirus.
Absolutely. We lack basic infrastructure in order to have the housing, the proper housing, the water infrastructure, and then the Wi-Fi, just having basic access. It really is a utility. It's not about a luxury anymore, and our kids are falling behind without that basic service of having access to Wi-Fi.
Red Dawn Foster, thank you for being here. Red Dawn Foster is a state senator from South Dakota. We will continue to wish you the best, and thank you for the work that you're doing trying to keep this community safe.
Thank you. Thank you.
Coming up next, we're bringing back our small business experts to answer your questions on how to navigate the next wave of the COVID pandemic. That means there's still time to get your business questions in. Send them to me at mystory@velshi.com. We're going to have more Velshi on MSNBC right after this, but I'm going to leave you with a beautiful picture of the Pine Ridge Reservation in the distance, right from above where I'm standing.
On Apple Podcasts.
Across the country, Americans are feeling the pain of this pandemic, whether it's through the loss of loved ones or economic loss. Millions have found themselves either unemployed, shuttering their businesses, or facing uncertain futures as the nation is swept by another wave of COVID. I'm back on the road, traveling across America to speak with those hardest hit by the pandemic, and we're answering your question about how to stay afloat during this tumultuous time. Joining me now is Jeff Mann. Jeff has been the owner of a tattoo and piercing shop in South Dakota for 20 years. This year, he had to shut down his business for 4 months, and since then, he's had to make changes to how he operates. Jeff, somebody actually tweeted me about you and your tattoo salon, and said, you got to talk to this guy about what he's done and what his business is going on. So tell us your story.
Thanks for having me on. Yeah, I have a small tattoo shop in downtown Sioux Falls, and we did shut down from March 17th until June 1st. It wasn't under any sort of a mandate. I think it was just the initial response to the pandemic and just a lot of doubt and not having a lot of guidance as far as how to respond to it.
And what did you have to do? I mean, your tattoo salons, hair salons, things like that, those are some of the toughest to convince your patrons that you are safe, and to convince your staff. How did you reopen safely?
We just followed all of the guidelines from the CDC and whatnot as far as maintaining distance when possible. We've certainly gone to a policy where we recommend masks for everyone in the building. We've had to cut down on some things. A lot of people want to show up with a friend or friends to get tattoos, and we've kind of reduced it to where it's just one artist and one client at a time in the shop. So.
And does that get you back, or get you at least close enough to the revenue that you're used to in order to stay alive, or are you still suffering?
We're definitely having a bit of a dip this year. I think we're managing. It's kind of hard to quantify when we look at the numbers where, when we were closed, the numbers weren't nearly as bad as they are now. So it's kind of doing some mental gymnastics, I guess, to justify why we're open with things being the way they are.
What's the best thing that can happen for you right now, other than the fact that we get a vaccine and life gets back to normal?
I guess I haven't thought of it in those terms. I hate the thought of seeing a shutdown. I think we'd prefer to just maintain our safety practices and be able to work through this. There's really no safety net financially for most of the people I work with and myself. So it's hard to contemplate a shutdown, I guess, when we've all got bills to pay.
Well, Jeff, thank you for joining us, and thanks for sharing what you're going through. We appreciate it. Jeff Mann is the owner of Vishnu Bunny Tattoo and Piercing in Sioux Falls, South Dakota. We want to talk more about the kinds of problems that Jeff and other businesses are facing in America. Back with me this hour to answer more questions from people around the country is my panel. Ashish Bhatia is a clinical associate professor of management and entrepreneurship at NYU Stern School of Business. Kim Weisel is an editor-at-large at Inc. She was previously a senior editor at Business Week. Thanks to both of you for being with us. Kim, I want to start because I'm talking to business owners and to workers, and I've got a question from Hannah, who says, I'm a freelance writer whose income was already uncertain pre-pandemic and of course is now more precarious. Though I found some modest ways to keep afloat, it's tenuous. I have no savings and no supportive family, and I'm currently single. Someone suggested I look into applying for back pay of unemployment. I haven't had time to do this as I've been so busy surviving, literally keeping food and housing security in check. What do you suggest for a situation like mine? This is a much larger issue here, Kim, that we're talking to a lot of businesses. Small businesses don't have accountants and lawyers on hand. Regular individuals have difficulty navigating around what's actually available to them. And in a community like I am, the community is impoverished. If you go out of business or you're out of a job, you don't really have much to rely on otherwise. So what do you recommend for Hannah?
Yeah, so we deal with a lot of freelance writers at Inc., and I have throughout my career. I completely understand when she says that it's tenuous. Work comes, work goes. One thing that is different about unemployment now is that you are eligible for it as what we call a 1099 worker. So if that is probably how she gets paid on 1099 forms, which means she is eligible for unemployment. And if her business has really suffered, which I'm sure that it has from her letter, she absolutely needs to look into that because frankly, there are not that many other options available to her. It's relatively new that someone in her situation could apply for this. And this pandemic shows just how much that's needed. So I hope she does it right away.
And that's a change, right? The idea that freelance workers, 1099 contract type workers can apply for unemployment.
Yeah, it's absolutely new. And they're also, depending on her business, she should also look into the PPP program, which is not happening right now, but she should be prepared if it gets re-upped in the new year, because again, that's a change. Self-employed individuals have never been able to apply for programs from the SBA. And more recently, they have been able to. So that's something she should be prepared for, but she should hop on the unemployment right away. And as you said, that's new.
Ashish, let's talk about cash burn, right? That's the biggest issue for a small business. The number one thing you've got to do when this thing came in is control how much you're spending. And that's terrible because for most businesses, the number one thing they spend on is labor. So they had to let people go. I've got a question from Robert who says, my wife Gina and I operate a tanning salon in Springdale, Pennsylvania, about 10 miles northeast of Pittsburgh. We're hanging on by our fingernails. We will be completely out of business soon. The PPP was useless to us. We weren't eligible for much in grant money. What sustained us is the pandemic unemployment assistance. That will expire on December 27th, and things will become dire at that point. What is your advice for us?
Yeah, this is a real challenge. I mean, we find ourselves in this place where so many of the stimulus programs are no longer available, and we're heading into winter. I think, one thing that I've been noticing and been thinking about is, thinking about how we can leverage again our resources that already exist. And one of those resources are our loyal customers. And so I imagine as a tanning salon, you have many loyal customers, and the question is like, are you able to maybe reach out to them, maybe do a survey and find out what is it that you could do to make this conditions in the salon such that people are going to come back in? And I'm surprised that I've definitely seen some businesses put out these types of surveys and these questions, and I think that could be an opportunity to kind of get the customers coming back in a safe way and a transparent way for them.
And Kim, lots of businesses, and again, it tends to be businesses with more resources to be able to figure out what the best practices are and implement them. But lots of businesses are marketing themselves now on A, the steps that they are taking to keep their employees safe, B, the steps that they are taking to keep customers safe, and C, the idea that they're a small business that needs your support, otherwise they will disappear.
Yeah. This is super important. And I mean, we've seen this in our community. I've got several surveys from businesses that I worked with regularly saying, if we did this, would you be willing to come back? If we did this other thing, would you be willing to come back? And if you're going to cancel your membership or whatever arrangement you have with us, would you be open to some sort of alternative arrangement so that we don't have to take the hit as a small business all at once? And I'm very happy to fill those out because I care about those businesses. I value the role that they play in my community, and I want to see them succeed. And I think that a lot of small businesses do benefit from that kind of loyalty. So I would encourage them to reach out to customers in any way they can and get the answers to those questions, and start to work with those customers, work with those relationships to see if there's something that'll be good for everyone.
And Ashish, this is interesting because in business school they will teach you to stick to your knitting. They will tell you to stay aligned with your principles, what it is you set out to do. So if you're a bakery, don't sell underpants in your store. But in fact, today you may have to think about the fact that if the demand is for underpants and you sell cookies, if you can manage to do that, you may have to do it. Things that you have to sometimes throw out some old business rules and say, this is what I need to do to get to the next stage.
Absolutely. A lot of our practices in what we teach in business school often focuses on planning and thinking forward where we have more certainty. But we're currently in a situation where the level of uncertainty is so high that those long-term planning tools we have to throw them out the window. So instead, ways to build your level of control, the level of strength of your kind of decision making is by using the resources that you have, who you are. That means like, what are you most passionate about? If you're going to be passionate about pivoting your business, then go for that. But if not, maybe it's time for you to actually, just focus on cutting costs. But then also to focus on, what it is that you're really good at. And lastly, who is it in your network that can be supportive of you and help you get through this crisis where we're dealing with so much uncertainty?
Kim, the business that I was talking to, the owners I was talking to yesterday, one of their businesses is a movie theater. There are no movies. They've been closed since March, but they open for a few hours a day to sell concessions. Believe it or not, people still want movie popcorn, people like me. So they're selling popcorn and concessions. It's not bringing in enough money for them, but it's bringing in something because they still have the ability to make and sell popcorn.
Yeah, and this is absolutely the heart of entrepreneurship, right? A lot of these business owners, if you think back to the beginning of their business, maybe the first thing they didn't really work out that well. Maybe it wasn't that profitable. Maybe over time they kind of adjusted and found the thing that worked for them. And they've been doing that now for a number of years. This is really going back to the beginning for a lot of people in a lot of ways, and kind of harnessing that passion and that flexibility and that desire to innovate that got them going in the first place, and say, okay, this isn't working. What's the related thing that could? And hopefully that will either open up a new long-term revenue stream for them, which would be great, or get them through this very difficult period until we achieve some sort of normalcy again.
Thank you to both of you. It is a real service to get out here and at least give some encouragement if we don't have all the answers for everybody. And in the end, some of these answers are going to come from new government programs that are going to extend grants or very, very low interest loans to some of these workers and businesses to help them get through until the time that we have a vaccine. There is light at the end of the tunnel, but it might be a few months away. Ashish Bhatia, great to meet you. Ashish is a professor of management and entrepreneurship at NYU's Stern Business School. Kim Weisel is the editor-at-large large at Inc. And as I said, there is light at the end of the tunnel, and it might have gotten a little brighter this week with the announcement that key COVID vaccines could soon hit the market. The question is, how do they get distributed widely across the country? How do they get to places where I am right now on a native reservation? I'm going to talk with global health expert and vaccine expert and coronavirus expert, Dr. Peter Hotez, after this. You are looking at the Pine Ridge.
John, Tom was obsessed with how to make underwear.
With millions of new coronavirus cases emerging every single week across the country, Americans are more desperate than ever for a COVID vaccine. In recent weeks, there have been some promising candidates. Pfizer and Moderna were the first two out of the gate with late-stage trials that showed both vaccines were about 95% effective. There was finally hope, with the world believing that there may soon be an end to this pandemic. Then came along AstraZeneca, which claimed that its vaccine would be 90% effective. Turns out that really depends on how you look at the data. The 90% was based on a half a dose first given to a group of participants, followed by a full dose they got a month later. The vaccine appeared to be only 62% effective in another group that actually got 2 full doses. It was apparently a mistake because the first group was accidentally given the half dose instead of the full shot as initially planned. And AstraZeneca still can't completely explain why the results differed so widely. So we're still waiting to find out how effective that vaccine is going to be. But it's something, probably about 70% effective. So that's still actually pretty good. Then comes the question. This is the big one. How do you distribute a COVID vaccine even once we have one? Pfizer's vaccine, for example, requires 2 doses and a very specific storage requirement, about minus 94 degrees Fahrenheit. And that doesn't cover the network and the resources necessary for a mass rollout of vaccines. Joining me now is the renowned Dr. Peter Hotez. He is an expert on vaccines. He's the co-director of the Texas Children's Hospital Center for Vaccine Development. He's a professor of pediatrics, molecular virology, and microbiology at Baylor College of Medicine. Dr. Hotez, it's good to see you. You and I talk a lot, but I wanted to speak to you specifically about the situation I find myself in now with the Pine Ridge Reservation behind me. They've got a clinic. If anybody gets particularly sick here, they've got to go off the reservation to a hospital in Rapid City or places further. I've got a clinic that has a pharmacy. I don't know if that pharmacy has a fridge that can handle the Pfizer medication. Maybe they can get one. But how do medications get to people like this, to people in impoverished communities, to people in very, very rural communities? Even if you're not impoverished, but you're where I am, you're far from a city.
Yeah, no, you're asking all the right questions, Ali. We know that the Native American population in the U.S. is especially vulnerable to COVID-19 with very high death rates in people under the age of 65. So, the narrative out there is everybody's over the age of 65. It's simply not true, especially among African American, Hispanic, and Native American populations. About a third of the deaths occur under the age of 65. So it's especially important to reach these populations. And you're right, it's really tough. This could be a pretty remote area, and some of the reservations are like that. So in that, and the fact that historically, Native American populations are especially vulnerable to infectious diseases in general and often don't respond as well to vaccination. So you put all that together and you've got a big issue. You're right, the Pfizer vaccine has a daunting logistical challenges because it's minus 94 to minus 100 degrees Fahrenheit storage required. It's doable. That's the answer. We know the Operation Warp Speed and General Perna have been working really hard to make freezers accessible. It may be that this one, and especially a lot of the rural areas, might be better suited for the Moderna vaccine because even though that also requires frozen storage, it's a typical household freezer temperature. So I think that one may be better suited, but we'll see how the logistics roll out. A lot of this is being coordinated now between the states and the Indian Health Service. So the Indian Health Service is a branch of Health and Human Services, and I know there's been a lot of consultation with various tribal members across the country this year. So hopefully this is all coming together to provide access.
There's also another problem when I note that in South Dakota, Native Americans are 9% of the population. They're 14% of the cases, 15% of the deaths. They have high concentrations in households. Some households do not have running water, and there are lots of comorbidities. There are a lot of people here who have existing conditions that complicate things. If you contract coronavirus, despite their efforts to stop it from coming into the reservations, if they get it, there's a higher chance of them dying from it.
Yeah, no, it's the perfect storm, because you're right. There are high rates of comorbidities underlying obesity and diabetes. That's a factor, and that's one of the reasons why you're seeing high death rates among Native American populations in younger age groups, often multi-generational households. So, a 20-year-old who's working on construction sites is then bringing that illness home to, or other essential workers bring that illness home to their 40, 50-year-old parents, and also bringing that home to their 70, 80-year-old grandparents, and things really snowball very quickly. And so this is why the National Academies has now rolled out a plan to emphasize the importance of underrepresented minorities in the vaccination program. But a lot of this is going to be left up to the states and the state health department, probably in consultation with the Indian Health Service.
Dr. Peter Hotez, it is a pleasure to see you again. Thank you. You are giving America some of the most important information that they need right now, and you will continue to do so with us. Thank you. Dr. Peter Hotez is the co-director of the Texas Children's Hospital Center for Vaccine Development and a professor of pediatrics, molecular virology, and microbiology at the Baylor College of Medicine, and truly one of the best sources, so follow him on Twitter. That does it for me. Thank you for watching Velshi Across America. Catch me on the road again next Sunday. I'll be in Portland, Oregon, to speak with local small business owners about their plight. AM Joy with Maria Teresa Kumar is up next. Stay with us. You are watching MSNBC.
I'm so glad that commentator done this in behalf of the Native American people, the Indian people. We're all vulnerable. It's not just the Native American people. But for some reason, there's ethnic groups out there that are showing statistically to have more of a tendency towards being affected more so by this coronavirus disease than it is others. I can't answer that. I don't have a solution to that particular question or an answer to that question. I have said before, and I'll say again, I believe that this is now merging into something that is supernatural, divine, to the point that basically Satan has been given permission of wreaking havoc upon to the Homo sapien race, up onto the planet. And God has basically lifted his shield of protection away from humanity and said basically, sick 'em. And this is the very thing that the book of Revelations teaches that's going to happen, for it says that it was as the noise of thunder. One of the beasts said, come and see, in regards towards seeing, a lot of people call him the Green Reaper. Even the words of Red said that in the last days, I will sever the wicked from among the just. Well, how is God going to sever the wicked from among the just? He's going to sever them by allowing Lucifer, the Antichrist spirit, the supernatural, invisible spirit, to basically wreak havoc upon to society. And it says it very clearly that Satan will rise up. In other words, he'll become stronger. The word rise up means become more powerful. That in the last days Satan will rise up because he knoweth his time is short. And of course we know what the Bible says about Satan, of what his job is. His job is to kill, steal, and destroy. And his job is to bring mass confusion. He's the author of confusion, and that's exactly what's happening right now in the year 2020 all over the world. It's not just happening here in America. It's not just happening to the Native American people. It's happening to all groups and all sectors of people all over the planet. And until we wrap our minds and our hearts around this and understand that a lot of this is in fact supernatural, a lot of this is pertaining to the sorrows, the great sorrows that the Bible talks about that will befall upon to the planet in the last days, until we wrap our mind around it in understanding it and believing it, we're probably going to be just as far out in left field at the end of the pandemic stage as we was on the front end of the pandemic stage. This is what I continue to tell my viewers again and again and again. This thing has merged into what it's doing right now. And like I said a while ago, on the basis of, 300 something million people here in America alone, it would probably take, if you had the drug already made and it was passed, and if everything went to the fullest, as far as everything being like it should, you would still be looking at probably 2 years to vaccinate all the people just here in America, not counting the people all over the world. So whenever you're talking about something that's going to be passed from one group of people to another, from one nation to another, from one ethnic group to another, you're talking about something that this is going to require the hand of God in either taking it away, destroying it, or eliminating this type of problem to humanity. But once more, I am thoroughly convinced that it has hit with a vengeance. Just like the Bible talks about that he will let me back up. The Bible talks about the blade, the ear and the blade, but in the last days he putteth in the sickle. What is a sickle? A sickle is something that cuts something. I don't know exactly the verse, but it's in the words of Red. It's in the words of the teachings of Christ. He said that the earth bringeth forth fruit of herself. First, the seed, which is Christ, then the ear, then the full ear. Just like a grain of corn, okay? That's growing in a field. But when the harvest has come, over 7 billion people on the planet, but when the harvest has come, he said that he would putteth in the sickle. What is that sickle? What is that that's going to cut the Homo sapien race right down to its core? I truly believe that God has released Lucifer, the Antichrist spirit, up into the world. Just exactly what it talks about in the book of Revelations. For he said that Satan would rise up with great wrath in the last days. And that's exactly what we're seeing right now. We're seeing Satan rise up. And you know, I thought whenever I first started interpreting that scripture, that whenever I started seeing all these mean, hateful things happening to the Americans over here in America, pertaining to all the school shootings and the massacres and all the drug inducements and the Homo sapien, the gay race and the lesbian race, of how that they treat each other pertaining to their whole demeanor towards each other, and seeing just the bad occurrences that was happening over here in America, I started saying even then that this is all the beginning signs of Satan rising up in great wrath. Because back whenever I was growing up as a young child, in the late 60s and the 70s, yes, there was bad events that occurred, but on nothing even similar to the level of what we're seeing today. You keep in mind, we've seen the destruction of almost 70 or over 70 people that died in Waco. We've seen the destruction of 168 plus people that died in the Oklahoma event. We've seen the destruction of going to war in the Middle East, of spending over $6 trillion, not counting all the lives it lost in the Middle East. We've seen the destruction of 9/11. We've seen the destruction of other major events pertaining to fires, floods, famines, hurricanes, right here in America. So if you combine all these things together and now throw in the coronavirus, along with Satan rising up in great wrath, yes, God has put in the sickle. Just he said that he would in the last days. He said that in the last days he would put in the sickle. First, the seed, then the blade, then the ear, then the full ear. But when the harvest is come, he putteth in the sickle. It specifically says that in the words of Red. He will put in the sickle. The sickle has been placed upon to the planet. And now people are scrambling. People are frightened. People have never had to deal with anything like this before. Now the Homo sapien race is realizing that they have made an error, a great mistake in not serving and being obedient to the holy living God the way that they should have had. That's the reason why that in the first 4 chapters of Revelations, he continues to talk to the churches, telling the churches, for I have not found thy works perfect yet. And we're not just talking about a perfect union. We're talking about a perfect church. We're talking about the bride of Christ. For I have not found thy works perfect yet. To go back, the scripture says. Go back and do thy first works over again. In other words, get your heart and your life right with the Heavenly Father. Humble yourself before him. Become his obedient subservient, because that's what he demands or requires in all of us. I hate to use the word demand, because if you use the word demand, all of a sudden you start thinking, well, God's a dictator. No, God will give you a choice, and whether or not you want to serve him or not. What God will do, though, he will make you regret that you did not serve him. And that's the part that the Homo sapien race down here up onto the planet don't truly understand whenever they try to put God in the category of being a dictator. Because God is not a dictator in that sense. Thank you for listening. Good luck to all of us. And once more, shalom. And God bless the Native American people, as well as the Jewish people and other people that has went through similar scenarios in genocide. Thanks again. God bless. Shalom.